As reported earlier, South Africa has recorded its highest daily COVID-19 infections with 17,710 new infections in the past 24 hours. The health department says the positivity rate of 33% remains a major concern during this second wave of the COVID-19 pandemic. For some, it is these kind of numbers that necessitate a speedy conclusion to the process of getting a COVID-19 vaccine for the country. But government has pointed towards the second quarter of next year being the time when such a vaccine could be available. The Solidarity Fund, which was established to support the government's pandemic response, has already paid a deposit to secure a vaccine, which will reportedly initially cater for about 10% of the population. But to clear up some misconceptions and perhaps provide further clarity and information about just how far the country is getting in the vaccine, we have set up a panel that will helpfully provide this information. This is also a moment for you, of course, to phone in. We'll put that number up on the screen. Also, you can get a hold of us on social media. I can already see a lot of you have asked some questions, which we will be posing to our panelists. Let me introduce you to our panelists. Joining us in a few minutes, we haven't got him on the line yet, Professor Barry Shoaib. He is the chairman of the Ministerial Advisory Committee on Vaccines. As we say, as soon as he gets online, we'll add him to the conversation. But right now, we're joined by Dr. Anban Pillay. He's the Deputy Director General at the National Department of Health. And Safura Abdul Karim is with the SA Medical Research Council Center for Health Economics and Decision. Good to have both of you. Thank you very, very much for joining us.
Morning to you and the viewers.
Yeah. Also,
morning, and thank you for having me.
Nice to have you, Safura. Thank you very, very much. I just want to get a very quick, before we get into this vaccine conversation, the numbers that were reported yesterday, the largest we've ever seen coming out from testing here in South Africa. Let's get your reaction to that, Dr. Pillay. What do you feel about these numbers?
It's very worrying, but I think we in some ways had anticipated that this may happen if people don't adhere to the usual non-pharmaceutical interventions that we recommended, particularly the mask wearing, social distancing. Hence, we've had to come out with many of these restrictions which limit the numbers. I think to some extent, these numbers may be a function of the vacation period where some people may not have gone in to test and they may have then, after the 25th and 26th, gone in for testing. And so those numbers may be now reflected in our daily stats that came out yesterday. But I do think that we still have the capacity as South Africans to make a stand against this virus by putting on our masks, by social distancing, and not participating in any gatherings that may contribute to the transmission of the virus. So I think those are key things that we can still do, and we can flatten the curve immediately if we wanted to. So let's get together and do that, because I think that's the best thing we can do for our country.
Okay, so let's get into our discussion about vaccines. I know that Dr. Pillay, you and I spoke earlier this week as well about the vaccines, but I think it just raised a lot more questions, and people are now asking a lot, and this is where we're actually inviting the public to be a part of the conversation. The numbers are on the screen. It's 7145877. That's 5861 or 5988. So we've got three lines open, and they will be phoning in and asking us some questions. In addition, we've got some that have come through on social media. I did have a conversation in the previous hour with Mark Hayward. I'm not sure if you managed to hear that conversation, but I am just going to pose a question that he wanted me to pose to you, Dr. Pillay. You had apparently yesterday, now I haven't seen it, I didn't hear it, so I'm just relaying a question, heard you saying that the date for the first delivery of Kovacs will be on the 20th of June next year. Well, from tomorrow, actually, 2021. Is that the accurate date?
No, we don't have such a date. Kovacs has not communicated a date. Maybe there's another Anban Pillay that he was listening to, but it wasn't me. The Kovacs facility had indicated that expect delivery in the quarter two. They are trying very hard to get us delivery before that. If they succeed with the manufacturers, then we may get delivery earlier. But we don't have a specific date as yet, no. And I don't think it will be on one date, because the quantities that need to be delivered to all of the countries, it's likely that we will receive vaccine in tranches. So we're not going to get our full request in one delivery. We'll get them in multiple deliveries. But the first date of that delivery has not been communicated. Kovacs has indicated to us that in early January, they will have a firm date on exactly when that delivery will come through. We'll certainly communicate that as soon as we hear what that date is going to be. But they're trying very hard, like we are, to access the vaccine as soon as possible.
I'm just going to ask again, because I think I asked you in our previous interview, negotiations with other pharmaceutical companies, independent from Kovacs, is that underway?
Yes. Oh, yes, it's been underway from last year. I'm glad Professor Shub has joined us now. He was very much part of those discussions. When the minister established the committee in September, we had a number of discussions with pharmaceutical companies, all of them that have produced vaccines. And they've shared the characteristics of their vaccine and when they anticipate their vaccines will come online, etc. So we've been talking to all of them. We continue to talk to all of them. The reality that all of them have is that every country in the world wants the vaccine. It's only the Pfizer vaccine that has been registered globally in many countries. And those countries have got into an agreement with Pfizer early on, are able to access the vaccine at this stage. Kovacs has as well, but the Kovacs delivery is coming, I think, a bit later. The only other vaccine that's been registered 2 days ago is the vaccine from AstraZeneca. So I think that will now see a rollout of more vaccine across the world. I think the Pfizer vaccine, one needs to bear in mind, is a vaccine that has to be stored at -70. So many countries did not opt to go with the Pfizer vaccine as a mass vaccination program because it's very difficult to do that, particularly in a country like South Africa and many other developing nations who do not have sufficient storage capacity for -70. We have commercially only 2 large storage facilities that will keep a -70 vaccine. And so we wouldn't be able to keep the large quantities required to vaccinate millions of people. And so many people are holding out for the vaccines that can be stored at fridge temperature largely. And I think those are still coming through. And hopefully, as soon as they get through, we can get access to them.
Yeah. I mean, I was reading reports yesterday about AstraZeneca, I think, striking deals with the likes of Brazil and India. I mean, temperatures there also very high and also at a very good cost. I think it's something like $3 per dose is something, and it can be stored and transported at normal refrigeration temperature. So, I mean, this sounds like a good option for us to actually head there. But have any of these, and again, I ask a question, and I'm not sure, and it's good to have you on the line. Barry, thanks so much for being with us this morning. I know that you're also joining our conversation. In terms of...
Good morning, yeah.
Good morning to you, thank you. You know, in terms of these companies and different pharmaceutical companies applying for approval from the South African government and from the likes of your organizations, has that begun to happen?
Well, I think that the companies that have registered vaccines in other probably file fairly soon. Pfizer hasn't filed yet, and that's largely because they don't have stock that they can supply. So I suppose it would make no sense for them to make an application and then we're not able to purchase any stock from them. But they have indicated they will be filing fairly soon, and AstraZeneca as well is preparing to file in South Africa. So I think in the next few weeks we'll probably see filings happen, and you may have heard publicly that Johnson & Johnson's provided some information, although the clinical trial data has not come out yet. But as soon as it does, I think they will probably file as well. So I think this next 3 to 4 weeks will probably see a lot of activity on that front.
Yeah, well, we hope so. I mean, Professor Shah, would you like to speak to us a little bit more about this? Because obviously you're the chair of the the Ministerial Advisory Committee on Vaccines. I mean, you may or may not have, and I did quote this particular article that came out in the New York Times, talking to the fact that we have so many different manufacturers that are actually making the vaccine here in South Africa, in our borders, but they're being shipped to distribution centres in Europe and Western America, and none have been set aside for South Africa. These are just some concerns that people are very, very worried about. So perhaps you can address some of the issues that have been raised here.
Yeah, thank you, Leon. Again, my apologies for coming a bit late. Well, firstly, let me clarify, no vaccine has been made in South Africa at all. There's one facility in Nelson Mandela Bay, Aspen, which is basically filling from bulk. They're getting bulk vaccine and filling into vials and syringes. And they presumably have a contractual agreement to do that. And obviously, they are just one of a number of facilities contracted to J&J for doing this particular task. Now, whether they will have some offshoot which will come to South Africa, I mean, clearly they should, but obviously this is their own legal contractual obligations which they need to satisfy. But they're the only ones. So the New York Times article is actually a bit inaccurate.
Yeah. So you've actually read the article and you're disputing some of the facts that they've actually put in there.
No, I've heard about the article and I had one or two things told. I haven't read it from cover to cover now.
Yeah, it's well worth reading and perhaps putting on a statement to dispute it, because a lot of, it's caused a lot of concern and worry that, once again, South Africa at the heart of perhaps helping the rest of the world by participating in vaccine trials, and the only way that anybody can actually get a vaccine is to participate in a trial. Other than that, they're going to be shipped off to other countries, and we're not going to be having access to these because of poor planning from the government's side and from organizations like yourself. These are some of the claims that have been made. So it might be important to actually have a look at things like that.
Yeah, no, you're absolutely correct. And I totally agree with you. I think, if the trials are being done in South Africa, if there's some contribution to making the vials, there should be some offshoot that does come to South Africa, but obviously that's a little bit out of our hands. But I should mention there is a big advantage in having a trial done in South Africa, because at least those vaccines have been evaluated in South African conditions. So we do have that advantage of having the trial in South Africa.
If I can come here, Leanne, I think it's important to bear in mind that these trials that were done were funded often by governments in those countries. So in the case of Pfizer, for example, they received a lot of support from the US government for the development of the trial, in the preclinical part particularly. And one of the conditions that most governments will have when they put in that amount of money into a trial without having a sense about whether the trial is successful or not, is that once the trial is successful and the product is produced, we will access the product first. So I think those are some of the things we need to bear in mind in terms of that. We've not funded any trials as such. We've only been participants in the trial as a country. And I think Professor Shoup outlines the benefits of participating in a trial as well.
Yeah. So let me... Okay, Barry, go for it.
No, there is one other benefit of having a trial, because once a vaccine, or in fact a drug, is registered, there is a post-marketing surveillance, which is extremely important, because that really gives us information of what in this case, vaccine behaves like in the field. And again, if there's experience in trial monitoring, trial evaluation, again, that is a great advantage to the country. So as Dr. Pillow said, it's funded from outside. We do have an advantage that we do have that expertise and experience in evaluating how these new vaccines behave in our situation, in our country.
Yeah. Let me bring you in, Safura, into the conversation as well, because I know that you're sitting there on behalf of the South African Medical Research Council. So, it is very, very important. I mean, this is it's a big decision and huge challenges that are facing South Africa, because we're seeing these numbers increasing. We're seeing more and more people being affected and infected, and it's now a vaccine that everybody is asking for. Let's get it from your point of view. Are you satisfied with where we are currently as a country?
Sorry, I just need to clarify one thing, which is I'm here on behalf of the South African Medical Research Council's extramural unit. We are based at the Wits School of Public Health. I don't speak for the Medical Research Council. I speak only as a researcher.
Great.
And in terms of whether or not I'm satisfied with where we are, one thing I would want to dispute is the idea that our situation is a result of poor planning. The reason that South Africa is not able to access a vaccine the way that the US and the UK can is because we're not a wealthy country. And that has, that reflects a historical inequity. This is something that is systemic, it's global, and it's been a problem for decades and decades. Poorer countries are always left behind when it comes to new health interventions. And that's not a result of our government not wanting a vaccine. That's a result of a system that prioritizes profits over people's lives. The US and the UK and many other wealthy countries were able to pour absolutely billions of taxpayer dollars into funding the development of vaccines, some of which will not work. And that was a risk that a country like ours simply couldn't take. So it's completely reasonable that now that results are coming through, we're looking at procuring a vaccine. That's actually a privilege. Many other countries that are poorer than us are relying wholly on the Kovacs system because that's the only way they can afford. In other words, they can't pay for the vaccines themselves. So actually, relatively speaking, I think South Africa is in a very good position. Government has taken very proactive steps to join Kovacs, try and negotiate with other vaccine providers. So we're doing the best that we can in a system that's not geared to give us access first.
Yeah.
I think, yeah, on that, I just want to clarify, if you go back to the time when the vaccine trials had started, that was last year, around mid-year, when many of the trials started. At that point, nobody knew which vaccine trial was going to succeed or fail. If you went with a vaccine from a particular company, you had no sense whether that vaccine was going to succeed. And to the point that Safura is making, can you imagine if we put all our money into a particular vaccine that hasn't come to bear or the trial failed because you had to prepay for these vaccines? It's not as if you'd only purchase a vaccine after it's been developed. All of these countries have prepaid for them. And it fails. We'll be sitting in front of the South African public having spent billions of rands and said, well, we actually don't have a vaccine because guess what happened? The trial failed and we took a risk and it didn't happen. I was talking to my colleagues in the UK that are responsible for the rollout there. And I asked them the question, so when did you start planning for these vaccine rollout? And they said to us, we had been investing in vaccines since April 2020. In April 2020, we just had our first cases. We were talking about a lockdown. And so these things were happening long before, many of us even knew that vaccines were being developed within those companies itself.
Yeah. Well, I mean,
I wonder if I could also come in there, if you don't mind.
Sure, Barry, go for it.
We're looking. I mean, just to amplify what Safura said and what Dr. Pillay said. These vaccines are brand new vaccines. The mRNA vaccine has never ever been used in human beings. The replication deficient adenovirus, which is AstraZeneca and Johnson & Johnson, have never been used in human beings. So these are kind of brand new concepts even. So there was a scramble, as Safura says, scramble literally to get that money, which they have, in a way, disposable money, and put it at risk to kind of go for those vaccines, as she said. We could not afford that. And it has turned out that the Pfizer vaccine has an excellent efficacy. We don't know how long that immunity is going to last. These countries have gone, and also I think the very important point, which I think we do need to make, and I think there's a general misunderstanding in the public. Once the vaccines arrive in our doorstep, that's not the end of the epidemic. It's not going to switch off the epidemic. Those first tranches will go to protect healthcare workers, won't have almost no effect on the population as such. Then there's got to be the immunization of the population, the whole population, what we call universal immunization. That's going to take a long time going to take months and months before we try and achieve herd immunity. So it's not that because we don't have a vaccine, we've got the epidemic. You kind of even look at the UK where they are rolling out very extensively. And they're having a very severe epidemic. It hasn't switched off the epidemic by any means. Yeah. They're having an epidemic far worse than their first wave in many respects. Yeah. In fact, our second wave also is worse than our first wave. So I think this is a common misunderstanding that's generally, I think, prevalent in the population. I think we need to clear that up.
I'm going to take a quick break. When we return, lots of comments, lots of questions, and callers also on the line. So we'll see you after this. With that, stay tuned.
Did you know that as a valid TV license holder, you can now win your share of R500,000 in daily prizes? Yes, you only have to renew or pay your domestic TV license. Then dial *120 *45887# or visit tvlicgames.co.za and take a chance at our Wheel of Fortune Spin and Win or Scratch Pad. Enter to win award-winning giveaways such as airtime, shopping vouchers and household appliances. Dial *120 *45887# or visit tvlicgames.co.za to enter now. Terms and conditions apply. USSD 20 cents per 20 seconds, R1.50 per entry. T's and C's apply. TV licenses, making more content possible every day. #made possible by you.
On Stories Untold, we travel far and wide to bring you stories packed with hope and inspiration.
I don't need to rely on government, I don't need to rely on anything, but if I can speak life into my situation and do not doubt what I say, but believe that what I say will happen, I will have whatever I say.
Stories of compassion.
And when I realized that there are people that go through 10 times worse things than me, I realized that I have a family, I have everything I need to be the person that I need to be.
Stories of Ubuntu.
I can honestly tell you the community, I think they have given me that extra boost to try and uplift other people's lives.
Stories of resilience.
When the door of me wanting to become a civil engineer didn't happen because of lack of financial background at that time, so I had to kick another door. When it was opened, then cycling was there.
Watch Stories Untold every Saturday at 5:30 p.m.
Right, welcome back. Continuing our discussion about vaccines, and our panelists have stayed with us here on the program. Just a couple of tweets and comments that have been coming in from some of our viewers. Some wanting to know what it is. Here's one. Karabo saying, good morning. Yes, even if the vaccine trials were funded by other countries, did the government not see the need to include term that a certain percentage be accessible to South Africans provided it's successful? AstraZeneca, aren't we getting, and why? Perhaps we can start with that one. Professor Sharp, do you want to answer that one?
These trials are organized on a kind of research basis. They're not organized really through the department, through the government. In other words, they would approach a clinical trial entity, which is usually an academic center, and negotiate with that academic center directly. So, and the academic center obviously has a great interest because it is of research interest, and it's very important to get that knowledge, as I mentioned earlier. But from a general vaccinology knowledge basis, but also how to monitor trials clinically. So obviously, from an academic point of view, it's of great interest, and academicians are very interested in doing these clinical trials. But the point is, it was bilateral between the academic center and the government overseas, or the funding, or the pharmaceutical organization overseas, not the Department of Health. So be registered.
Yeah, Dr. Pillay?
No, I just wanted to explain the process, because I think many people have asked this question. When a company wants to do a trial in a country, they apply for approval to the regulator from a scientific basis. And the regulator assesses the science of the trial. And if the regulator is happy with the science, will then approve the trial. There's then an ethics approval as well, and the scientific committee, etc. In that process, the department is not involved. And as Professor Shub has mentioned, there is a contract between the pharmaceutical company and the principal investigator and investigators about running the trial, because they're doing this on behalf of the company. If the principal investigator, insists that I won't do this trial unless you say to government that you're going to give them this amount, then that can happen as part of that contract. But in the case of the AstraZeneca or any of the other trials, as far as I know, the principal investigators have not got into any agreement to say, I won't do this trial for you unless you give government the stock. So this didn't happen because it was a private arrangement between the company and the principal investigator. We as government only came to know after the trial actually started, because we have no role in that process.
Dr. Pillay, I've got a question for you while you're actually speaking. It's coming in from one of our viewers, Glenn, saying, Pillay is talking bull. That's what it says. You can proactively order vaccines that have not been registered on the basis that you only buy or take them if they become registered. Otherwise, your purchase price is a percentage-wise is refunded, as well as the other countries did ahead of time. Why are we so backward in our vision?
Now, I don't know who Glenn is, but Glenn needs to be sitting in the meetings that Professor Shub was with me, and the companies had made it very clear that if you want to buy vaccine, you need to get into an agreement which includes prepayment on a risk basis in order for you to participate in the first allocation. So a risk basis means I must sit here and tell you that I put money into this machine and the machine didn't give me a jackpot, and I'm sorry, all the money is lost. And that's a risk that we were not keen on taking, but I'm sure Professor Shub and Safur will also share with you what the international agreements are, similar to the ones that we were presenting.
Okay.
Absolutely. I support that 100%.
Yeah.
I'm not aware of any clinical trial where the principal investigator has made it a condition that there has to be a supply of a particular drug which is being evaluated. It is done on an academic, scientific, motivational basis.
Okay. Let's go quickly to... please, go for it. A comment?
Sorry, I was just going to add two things, which is the one is advanced market commitments in general function exactly as Dr. Pillay explained. So it's not like this is special to a COVID-19 vaccine. Just in general, if a country is buying or committing a certain amount of money to fund the development of an intervention, they lose that money if the intervention doesn't pan out. And the second thing I was going to add is, even what Glenn described, there is a mechanism within Kovacs whereby you can pull out of the Kovacs arrangement, but that comes at a much higher cost.
And price.
So you have to pay for that convenience.
Okay.
So I just wanted to add those 2 points.
No, important. I think this is what we're doing this discussion for, is to get some clarity through. Here's a question. We'll put it up on air. This is another tweet coming through that we've managed to copy. It says, this is from Tulani, saying, is there a probability that vaccines are meant to alter the DNA of human beings? This is asked because COVID-19 and N1H1 was commonly viruses or diseases solely affecting animals, now affect humans. Is the human being DNA equivalent to that of animals now? Okay, fair enough. Who wants to grab this one? Let me ask two at the same time. Please, could you elaborate on side effects, if any, pertaining to the vaccine? I could answer that. We don't know yet, I suppose, because there's just so much unknown right now. But the DNA, the altering of DNA, would you like to go with that one, Prof?
Well, the short answer is no. It's actually impossible. It's biologically impossible. These vaccines, the mRNA vaccine, by the way, not a DNA vaccine, the RNA. RNA is a messenger which takes the message from the DNA and translates it into protein. But in either event, that mRNA, it's incorporated into a lipid capsule, gets into the muscle cell, and then it's degraded. After that, there's no more mRNA. It's completely gone. It's done its work. It codes for the protein stimulates the immune response, and that's it. That's just a mechanism to get that genetic signal into the body to make the protein. But after that RNA is gone. There's no evidence whatsoever of the RNA. So biologically, it would be impossible. There's no feasible way that the DNA of a person can be in any way affected by any of the vaccines, by the way.
Okay.
There are side effects, yes. In fact, they're usually minor side effects. There may be a little tenderness of the arm, there may be a very mild temperature after on the day after, and this has been noticed, but obviously they're very trivial. There have been 1 or 2 reports of allergic reaction to some of the constituents, the stabilizers and so on, which go into the vaccine. And there's been a cautionary note with regard to the Pfizer vaccine, particularly that people that are prone to allergies should receive the vaccine under medical supervision. But that's very uncommon. The vast majority of cases, it's very mild, mild side reactions.
Yeah, I even saw a report coming out where it was in California. I'm sure you saw this one. A nurse, after having the vaccine, tested positive. I don't know if you've got
Yes,
views on
I've seen that.
Yeah. A bit of a worrying development, or expected?
And no, I think it's timing. I think that person became positive, I think, within a week after getting the vaccine. So I think it's just unfortunate they picked up the infection, they got the infection, because you must remember that the vaccine, well, first, the Pfizer vaccines, after the first shot, is only about 50% effective. That's why we need a second shot. So that's what's called the priming, the first dose, and the boosting is what actually gives the effective immune response. So they wouldn't have had that effective, and also it does take normally about 10 days to 2 weeks to get an effective immune response. I think that person was just unlucky to get infected just before getting the vaccine.
I'm rushing us along because we don't have time. We've got to also take a break. But I want to put this one up. This will be our last one in this segment. We've got to take a break afterwards. But we've got a couple of these tweets coming in. And this is from doctors. As a doctor working in a busy intensive care unit, how can the government ethically justify the lives lost due to their delay in procuring and distributing a vaccine for our country? This is from David Lee Skinner. Another one, good morning. Are you supposed to be positive first before receiving a vaccine, or will it be precaution is better than cure? Can we quickly answer those ones? I'll go to Mickey's one after the break. I don't think we'll have time to put three in a row. So the first question about doctors and procuring, and then that next one.
If I can take the one around the procurement. I mean, we've not delayed as such the procurement at all. We took a decision at the time that we would go with the Kovacs facility, because the Kovacs was purchasing vaccine from multiple vaccine producers rather than taking risk and going with one vaccine supplier. So there was no delay as such in the procurement process. As soon as we were presented with an opportunity, we had indicated, in fact, Kovacs had communicated with us in late September, and within a week or two, we had provided them with a non-binding agreement that we will procure through Kovacs. And we thought this was the best way to procure, and I think many countries in the world are actually going to go through Kovacs. I think there's 198 or so in the last count that will purchase through Kovacs, because that's the safest mechanism. I think Sephora has explained why it was the logical approach at the time. Thanks.
Okay. The second question, I've even forgotten what the second question was. That's what happens. I think my brain is finished by this time of the year. Anyone remember it?
Yeah, I think it was about the ethics of not...
Thank you. Go for it, Prof.
I think it's a very good question, because it is one that has come up. Clearly, it would be ethically indefensible if there was a vaccine to withhold it from healthcare workers. That's obvious. But the healthcare worker group is the top of the priority list, universally throughout the world, and it will be in this country as well. Clearly, they are at the front line. They are at risk of getting infected. And also, they are a key personnel. We don't have a shortage of healthcare workers due to an outbreak in the healthcare worker community. I think, are they risking their lives? Well, clearly they are by being exposed. I think we're not quite sure, is the kind of mortality, healthcare workers also mix in society. Do they pick up the virus from society, or is it an occupational risk? Have they picked it up occupationally? So I think that need to be established. But clearly, it would be ethically, if it was available. We were doing our utmost to get vaccine as soon as possible, and the first people to receive the vaccine would be the healthcare workers. So I think we can defend it ethically.
Yeah. We're going to take a very quick break. We'll come back after this. That Johnson & Johnson question, hopefully we'll squeeze in, as well as a few more. And then we're going to say goodbye to our SABC 2 viewers, unfortunately. But let's quickly take a break.
Hello Mzansi, I know you love watching your soapies and sports on SABC. I love watching Network on SABC too. But I do the right thing. I pay my TV license. It's only 265 rands a year. That's 22 rands a month. Do the right thing. Pay yours.
What are we to do when we ask a judge to recuse themselves because we have a reasonable apprehension of bias?
Mr. Zuma's statement that we are friends is not accurate. The applicant has failed to meet the test for a reasonable apprehension of bias. Accordingly, I conclude that the application for my recusal falls to be dismissed.
We will excuse ourselves right now.
The applicant would be acting in defiance of the summons.
Mr. Zuma has left, I have been told. I have decided to request the Secretary of the Commission to lay a criminal complaint with the South African Police against Mr. Zuma.
A vital discussion that we're still having here on Morning Live, and we're going to continue doing this on SABC News. We've got a couple of your calls that are waiting. We're going to take them on air. We've also got lots more tweets as well. Also asking the question about independent pharmaceutical companies seeking approval and whether or not, as an individual, you can actually go in and buy that for yourself, not actually waiting for the government process to roll out. So those are just some of the questions that we've received that we are going to be asking, but unfortunately that'll be happening on SABC News, so switch over to channel 404 if you have access to it right now. But for our SABC 2 viewers, all that's left for me to say is have a fantastic evening today. Remember, stay home, as the minister said. Don't be caught out after the curfew at 9 o'clock. But I'll be back with you in the middle of January. This is where I say my final goodbye for the year. You take care of yourselves. God bless you, and I look forward to being with you next year. Bye-bye, everybody. All right, welcome back. Let's continue to have this discussion now that we've still got going live. We will be doing it for as long as we possibly can in terms of the timing on the channel. But let's have a look and see one of the other tweets that have just come through now, and this is regarding the Johnson & Johnson issue. So let's put this question up. It's coming from Mickey Maraba, and it says, "Good morning. Johnson & Johnson did ask to apply to verify and approve the vaccine before it can be rolled out. Apart from Johnson & Johnson, is or are there any companies available to verify and approve the usage of this vaccine?" So let's get that question to one of our panelists. Wanting to ask there about the Johnson & Johnson vaccine?
But it was not the final clinical data that's required for the purposes of a regulatory authority approving its use or not. That work is still being done, and I think once it's ready, I'm sure the Johnson & Johnson will file that with our regulator. As I understand it, Johnson & Johnson's not finalized their clinical data as yet, and so that's not available at this point.
Yeah. Can individuals, and if once they have gotten regulatory approval from medical councils, from government, will individuals be allowed to go in and be able to, if you can afford it, get a vaccine without waiting for Kovacs and a rollout of that?
Well, it's an interesting question, Leanne. The point is, if you wanted to go in where, and wherever you go in to get the vaccine from, because all of the suppliers that have the vaccine have indicated they, at this stage, don't have stock. And when they did have stock, they were going to supply it to government. So I'm not quite sure where one would get the vaccine from. I mean, you can probably pay whatever price you like. The point is that the vaccine is not available at this point because they tied up in a number of global agreements with various countries. And at some point, we will get the vaccine, hopefully sooner rather than later. And that's what we're all trying to achieve in terms of vaccine access, especially for our healthcare workers. But when the vaccine does become available, it will be through government, and then they will be supplying to both the public and the private health systems as such.
All right. We've got a caller on the line now. Let's take her. Irene, not sure where you're calling from, but good morning to you. What is your question?
Hi.
Hi, Irene. What is your question?
Hi, Leanne. Good morning to you. It's great speaking to you and the viewers.
Thank you very much, Irene. What is your question?
I would like to ask Dr. Pillay, can we give meat to babies? Because I feel, as a citizen of South Africa, that we are being deceived with medical information that is not upfront truthful. Because all we hear, we have been given from the medical board, I will call it milk, because we're all adults, and what we've been given, the information and the background, is deception. Because nobody is standing up for the truth when it comes to the vaccine. One has to look at themselves and say, as a nation, how long are we going to be deceived with false information? We as a country, we are adults. We cannot be deceived. Mr. Dr. Pillay, he gets very aggro when asked a direct question. He's not forthright in his answers. And I think he should actually answer truthfully and honestly to us as South Africans.
All right, Irene, let's get a response from Dr. Pillay on this one.
I'm not sure what Irene's referring to because I didn't hear a question. Maybe you can help me, Leanne, as to what is Irene's question. I heard her express an opinion, but I didn't hear a question.
I was Irene. Also, in the beginning, Irene, are you still on the call? Is she still there, Irene?
I am.
You are. So the question you asked, I might have heard it wrong, but it was something about giving meat to babies. Was that it, or the vaccine? What is your actual question?
My actual question is, I'm not a medical person.
Okay.
But from the medical side, we are getting misinformation and we are being deceived as a nation when it comes to the vaccine. And I've been watching Dr. Pillay's response to the reporters asking questions. He becomes very aggro and denial.
Okay.
When are we going to get the truth concerning this vaccine that so many people are waiting for?
Okay, all right.
There's so much of hearsay.
Okay.
What's the question that you'd like me to answer, Irene? Because I hear you expressing an opinion, but I'm not very clear about what your question is.
The question is, number one, how secure is this vaccine that you are bringing? Number two, what is the side effects? Number three, what the government has done up until now in the 280 days that we've had as medical people? How have you all held government accountable for what's been happening from the medical side? We have professional medical people in South Africa. That same money that is being given for the vaccine, why is it not given to our medical people in South Africa?
Okay. All right, Irene, I think we've got your questions. Let's do that. Thanks for calling in. Dr. Pillay, perhaps you want to respond to a couple of those questions that Irene put towards you.
I think the first question was, how secure is the vaccine? Well, I assume Irene means how effective it is. If that's the question, that's what the regulators will determine as to whether the vaccine works or not. They wouldn't register the vaccine until they're convinced that the vaccine actually works, and they do that independently of government and independently of the companies, and that's the role of regulators in all countries. So we certainly will not bring a vaccine that is not shown to be effective. Same thing with safety. The regulator will make that determination. They will go through the evidence and confirm to the South African public that it's safe and effective to use this vaccine and it's of good quality. On the issue about giving funds to the medical profession, I'm not quite sure I understood that, because the pharmaceutical company that produces the vaccine will then sell the vaccine to us and we have to pay for it. And that payment we have to make to them. We can't make that payment to our medical professionals because they didn't produce the vaccine. So I'm not sure I understood the question well, but from what I heard, that's what I understood. But maybe the other panelists would have a view as well.
Okay. We've got... yeah, please go for it.
Sorry, I just wanted to add one thing about vaccine approvals, which is there have been a whole lot of countries like Costa Rica and Morocco and the United Arab Emirates, and they started rolling out vaccines before phase 3 trials had been completed. And what they did is they granted emergency use approvals that would allow them to roll out a vaccine without any evidence of its effectiveness. Now, we haven't taken that approach, and that's a really good thing. Our regulator is ensuring that any vaccine that is rolled out is comprehensively evaluated and shown to be effective before people receive it. So people can rest assured that part of the delay in rolling out a vaccine is making sure that it's safe and effective for people to use it in South Africa.
Okay. Quick phone calls here. I'm going to got Mohammed up first. Mohammed, please, good morning to you. Please be brief and ask your question directly. What is it that you'd like to know?
Good morning. Just a few comments. Number one, to Safura, I disagree with you. You've never worked in an ICU and looked after a critically ill patient with COVID. Ask any one of us and we'll take an unproven vaccine today. Mr. Pillay, a comment to you. You spent 500 million rand on Cuban doctors, but you're not willing to take the risk for South African healthcare professionals and the vaccine. And Professor Shu, a comment for you. You mentioned that healthcare workers can get the virus in the community. That is true, but come to one of our ICUs and take note of all the nurses and the doctors on ventilators. They all have been actually isolating from their families for months. They've not been going to communities. They've been working 7 to 7. None of us are getting the virus partying. None of us are getting the virus anywhere else. I think you owe us an apology. We are
all right, Mohammed. Point taken. I'm not going to get comments from the panelists because I think that in itself was a comment and directed towards each one of you. So we'll take that. Tony's on the line as well. Tony, do you have a question?
Hello.
Hi, Tony.
Good morning. Yes, I do have a question. Can you hear me?
Yes, perfectly clear. We're listening to you.
Okay. The first question is, why did South Africa join the Kovacs program when we have several suppliers? As part of the BRICS countries, we are able to get product from countries like Russia and China, and they are offering it to South Africa as with priority because we are members. And the procurement process that is being followed seems to be flawed because these people that are procuring it are probably doctors and not experts in procurement. And secondly, there are prophylactics that are available like ivermectin. Why didn't these professionals look at that to bring that in immediately, which is immediately available for human use, that can start stopping the spread of the virus almost immediately? And Professor Koki from America is a pulmonologist. He's done various clinical trials and he's proven that you can stop this COVID-19 with immediate effect using ivermectin.
Yeah.
Thank you.
Amazingly, you're not the first person. I actually picked up one on social media talking to that. Again, I'm going to come to you, Dr. Pillay. Do you want to begin answering a few of them? And if anyone wants to add, please go ahead.
I can start maybe with the issue around the Cuban doctors. You know, when we brought in the Cuban doctors, we didn't have the presentation that Cuba said, we may or may not send doctors, you give us 500 million. And when the plane arrives, you can see whether anyone's in the plane. They didn't tell us that. They said, if you are able to, pay for this, we can send these doctors. In the case of the vaccine, you're going to be paying for something and you don't know if it's going to actually arrive. So it's a risk arrangement in terms of the Public Finance Management Act. Government and the Department of Health in particular is not allowed to get into a risk arrangement. We're not allowed to take gambles or bets about which vaccine is going to succeed and not. And so I think it's important to understand the restrictions that we have in terms of government and how we're supposed to procure. I think on the issue relating to the BRICS countries, it's a very good question. So yes, it's true that the Chinese have developed a vaccine and so have the Russians. And I think both of them have made some presentations to the Ministerial Advisory Committee, which Professor Shub has been part of. Both these vaccines have not gone through the clinical trials that we would anticipate are necessary in order to confirm the safety and efficacy of the vaccine. I think in our meetings, those that were developing the vaccine appreciated that. And to that extent, there are trials that are currently ongoing for both those vaccines in South Africa using various partners. So those trials have not been finalized yet. And I think Safura made the point that some countries have chosen to move with the vaccine even before the data is available, which is in itself a gamble, because you don't know if you're injecting people with a vaccine that works, that's safe and effective. We've taken a more cautious approach, yes, because we would value that our citizens should be given a vaccine that's safe, shouldn't cause harm to them, firstly. And then secondly, if it does work, it should be able to protect them against the virus. There's no point us saying we have a vaccine, injecting people, and then a few months down the line finding out, no, hell no, this vaccine actually is not working and people are still being infected. So we'd like to take the time to make sure that all of that's in place. So that's the reason we haven't procured those two vaccines to date, but both of those vaccines are being trialed in South Africa. Yeah, well.
All right. Dr. Pillay, thank you very much for answering. There was also a specific question regarding, I don't remember the name of the drug that is being used. I don't know if anyone wants to address that.
Ivermectin, yes.
There we go.
Ivermectin.
Okay, go for it.
Yeah.
What is our response to that?
Well, I think Professor Shub would also have a view on this. In terms of ivermectin, there's been a number of claims about its use, and I think there is much debate in the medical fraternity about whether it works or doesn't. From the clinical trials, it's not as yet conclusive whether it definitely works. So the advice from the Ministerial Advisory Committee, as well as from the Essential Medicines Committee on this, is that we should be considering a clinical trial that confirms the efficacy of the product rather than just using it in a routine way, because at this stage, we're not really sure if it works or not. That's the proposal that's been made, and SAPRA has indicated they will not approve the drug for routine use based on the evidence that they have. I do know there are many people who believe in the product and give you stories of how well it's worked on their patients. But on the clinical side of things, the data is not as convincing as regulators would like. So that's why SAPRA has not registered it as yet for that particular indication. I know Prof. Shub would probably have views on this too.
Prof. Shub, do you want to go for it?
Well, I think Dr. Pillay has really outlined it. Basically, there are a number of these drugs which we call them reuse of drugs. These are drugs which have been designed for other things. We had hydroxyquinone before, which is a malaria drug, which is again in clinical trials not shown to be effective. That did have a very high profile because various political leaders in the developed world were touting it as a magic drug. I won't go into it in great detail, but I think you know what I'm referring to. And that was then it didn't have any on a clinical trial when it was evaluated, it was found not to be therapeutically effective. And I think ivermectin has also been kind of investigated. When one does these in the laboratory, these drugs will, of course, inactivate the virus, but it doesn't mean it's going to work clinically. Ivermectin is a drug which has been designed to treat worms, roundworms particularly. And yes, it will inactivate the virus in the laboratory, but so will many, many other chemicals. And certainly the clinical trials which have been done have not shown it to be therapeutically effective. We do have many anecdotal reports, doctors who may have given it to their patients, the patients recovered, but it's not done on a trial basis, so we can't know, did they recover anyway despite the drug, or was it because of the drug? The only way you can really establish that the drug has got an effect is you do a proper, well-controlled clinical trial. So far, and it's not to say that there shouldn't be ongoing research, there should be, but so far no clinical trial has shown it to be effective. And because of that, it can't really be recommended or registered for widespread use.
Okay. We're getting a lot of questions about tiers, what the tiers are in terms of receiving the vaccine. That's the one. I think we need to highlight that because that was a question even from Mark Hayward that we got in the first hour with regard to what is the actual planning once we do get the vaccine, who will be receiving it and the like. So that's one of the questions I'm picking up from a lot of our viewers. And then I also want to ask about children, because there has been, in the beginning when we heard about COVID and we needed to protect the vulnerable, those with comorbidities, those that are elderly, we needed to look after them. In terms of children admissions into hospitals, how is this new strain affecting children and younger, whether it be teenagers or whatever it may be, the younger people in our population? So perhaps we talk to the tiers of distribution once we do get the vaccine, and also the effect on younger children and even in hospital at this point in time. Maybe if anyone's got that information, you can share with us.
All right, mate. Could I start off with that? Because I'd like to also just comment on the previous listener who said I should apologise. The top tier, and I think this is universal throughout the world as well as now, are the healthcare workers. And I'm extremely sensitive to the plight of the health workers. In fact, my son is an intensivist, and he's told me lots of put me in the picture of what they are going through. So I'm very sensitive personally, but also in our role as the advisory committee, we have put the healthcare workers at the top of the list. They need to be protected not only because they are such key personnel themselves, but because they are vulnerable to infection. They are, as is often said, putting their own lives at risk, as well as the kind of stress that they're undergoing. They would be top of the list. And also the elderly, because they're at risk of the complications, particularly the elderly who are in nursing homes or in care homes. And then also there are various key personnel which do need to be defined over and above the healthcare personnel. And then also people that are institutionalized, for example, people who are incarcerated or other institutions, again, because if the infection were to be introduced there, it could spread very, very rapidly for obvious reasons. So that would be the top tier for the first tranche of vaccines which come online.
Okay, so top tier is medical. Then what else are we looking at? Elderly?
Medical, elderly, particularly the elderly who are in the nursing homes, care homes, key personnel, and people in institutions.
And then those with comorbidities, yes.
Okay.
Yeah, that would be the second tier, the comorbidity, because the problem with the comorbidities is actually to actually define them, to put a number to them, to ring fence them, because comorbidities are a sort of a grey area. The elderly are easily defined.
Yeah. So somebody like myself, I'll be selfish here. I'll take it. When do I get access to this? I'm in my 40s. I've got no comorbidities. I obviously fall to the bottom of the rung, but when? Where do I fit in?
After the first tier, or the first group have received their vaccine.
Yeah.
You see, I think the vaccine strategy has got two arms. The first arm is to protect those who are at risk, either at risk of getting infected or at the risk of they get infected from getting severe disease. That's the first risk. That's personal protection. That's probably not going to have too much effect on the actual epidemic itself, as we've seen, for example, in the UK and the EU and so on. The second level is what we call universal immunization, to try and get herd immunity, to try and immunize as many people as possible, to try and reach that threshold where the epidemic gets controlled. The virus never disappears, by the way, but the epidemic gets controlled. There's only one virus which has ever disappeared as a result of vaccination, and that's smallpox.
And it's something that obviously what we've gathered is that this will be an ongoing vaccine that we'd have to get more than once. If it shows true, it could be maybe an annual, even twice a year that we need to get this vaccine?
I think it's too early to tell how durable that immunity is. They're certainly looking at, from an immune point of view, all the signals are very positive that there's memory cells and so on. But how long that effective immunity will last is too early to tell.
Okay. Quickly,
maybe annual, it may be a few years. Hopefully it'll be a lot more than a few years.
Hopefully. Quickly, in terms of the children, then I'm going to have to wrap up the conversation. Dr. Pillay, do you have stats for us on how many kids are actually in hospital at the moment, teenagers? What is this virus now doing to the younger generation?
Thanks for the question, Leanne. I don't have the statistics in front of me to give you the exact number, but what is very clear is that from the first wave to the second wave, we have certainly seen more children being hospitalized and presenting with a severe form of the infection than we had previously. It's not clear whether this is a result of greater numbers of children being exposed, because children generally don't present with the symptoms of COVID as adults do, and so it may be more difficult to determine whether children were infected or not. But certainly we're seeing more hospitalizations of children than we saw before. Having said that, I think on the clinical side, Prof. Shub will probably be best to respond to that issues.
You want me to respond, Leanne?
Please do, if you can, very quickly, Prof.
Okay, well, I'll just very quickly. Children would be at the kind of lowest level of requirement for vaccination. In fact, many programs overseas don't include children in the universal immunization, on the hope that we can achieve herd immunity without having to immunize children.
Okay.
Children seem to be less of a problem in terms of clinical disease. They seem to tolerate the disease very, very much more mildly. The only reason really comes from an epidemiological point of view. Are they spreaders? Are they carriers of the infection? It has been noticed more recently that there are younger people that are being affected, I should say, as well as infected, and perhaps more seriously than in the first wave. But that's still work under progress.
Okay, we're going to wrap this up now. I wish I could carry on all morning. We have got so many queries and questions. It's unbelievable. But the one glaring one that comes through, and as I wrap this up, but I am going to hand this over to you to each sort of give us a closing remark in please, 30 seconds or so. Many South Africans are very concerned that, we talk about the expense of a vaccine, we talk about the protection of South Africans, and yet there is so much wasteful expenditure, 500 billion rand that we're still waiting to see accounted for, that there is just so much misspent funds and corruption that we've seen coming out of this pandemic that we find ourselves in, that they're finding the pill very hard to swallow, that we can't afford vaccines now. This is just one of the themes that I'm picking up. Perhaps maybe in your closing remarks, you can add this in as well, the money issue. But let me begin with you, Safura, if you'd like to end this off for us, because I know that was one thing you did bring up about the fact that we can't necessarily afford this.
Well, I think, I, like many South Africans, am critical of corruption. I don't think it's appropriate, and I think it's particularly galling in the middle of an epidemic for people to be profiting and benefiting themselves instead of others. So I agree there. All I will take this opportunity to say is to reiterate what Professor Shub said earlier, because I think too many South Africans believe that the vaccine is the silver bullet to ending this pandemic and this epidemic, and really, that's not going to be a reality for quite some time. People need to wash their hands, maintain social distancing, adopt all of the measures, the non-pharmaceutical measures that they can. The vaccine is not the solution in the short term. We're talking about much, much further in the future. People need to, for the time being, take responsibility and do their part in controlling the epidemic.
All right. Thank you very, very much. Dr. Pillay?
Thank you. I think Safura summarized that very well. Just to say that even if a vaccine arrived in South Africa today, we will still probably have a third and a fourth wave, simply because the time it takes for a vaccine program to go out to, 2/3 of your population at least to get herd immunity will take a while. And I think Prof. Shub explained why that is. So it's important that we continue with the non-pharmaceutical interventions of mask wearing, social distancing, staying away from gatherings, etc. Those are really important, particularly today, which is the 31st of December. And, many people like to party during this time. So I appeal to them not to do so. On the issue about the funding, let me just say that, look, we all are not happy about corruption when it happens. But that funds are not available to us where we could have taken it and used it. We have the money we have, and we have to obviously operate within the budget that's been allocated to us by the National Treasury. So it's very difficult for us to maneuver within the limited budget we have. We don't have sources of other funding that we could use.
All right. And final note, Professor Shub, talk to us.
Yeah, I just want to comment. I think there's a bit of an unfairness that the delay is due to that we can't afford it, or it's because of inactivity. There's a lot of activity that is going on. Some of it obviously is sensitive and confidential, can't be released for obvious reasons. But there is a lot of activity. We will be getting vaccines. We will be getting vaccines as soon as possible. As Safura said, it's not going to be the magic bullet immediately. I should mention that there is one slight advantage that we do have over those countries which have rushed into getting the vaccines. There are now more and more vaccines which will be coming online. We have a wider choice that we can evaluate vaccines, and look at vaccines which are in fact most suitable to our conditions in terms of safety, in terms of efficacy, in terms of storage, in terms of distribution. And that does give us a slight advantage, in fact, over other countries. But I agree, we are all anxious, we all want to get the vaccine as soon as possible, and that all efforts are being taken to get it as soon as possible.
Thank you so much to our panelists for availing themselves to us today and for giving us as much information as we can. Happy New Year to all of you. I hope that you get a little bit of a break, but remember, ulele, you've got to be sleeping by 9 o'clock, all right? That's an order from the minister. Thanks very, very much, everybody. We'll see you in the new year. All right, that wraps up.
Thank you.
Absolute pleasure. That wraps up our discussion on vaccines. I hope that we gave you some information there. All right.